Awesome. So we wanted to let everyone know that in November, we're doing a member appreciation event. So we're doing a virtual trivia event. It's with Underdog Trivia. So we're gonna all join, and they're gonna split us up into groups, and we're all gonna have some fun competition and answer some fun questions. It's nothing, this isn't like HR trivia. You better be on your best game. This is fun for us to network. And we're doing it from 4:30 to 6, so it can be a little happy hour for any of those who would like to make it a happy hour. But I know a couple of our people who have participated in them had a lot of fun and thought this would be a great thing to do for our members. It is something we are doing for free. So we hope everyone will be able to sign up and have a good time with that. So we'll send out some more information, and hopefully everyone will be able to join us for
that. We'll wait a couple more minutes to get started. Those that are here, we just want to encourage you to either be on video or be on chat, so that if you have questions or if you have comments or something really is like, yeah, that was awesome, let Clayton know, because, as speakers, while we're trying to do this virtual thing, it's fun to hear the interaction. So we will be posting some comments and stuff online as we're going through this. So feel free to engage via chat room. And if you don't know where your chat button, if you go to the bottom of the screen, sometimes it's not always there until you put your arrow down there, and then you'll see the chat, and then you can pull it up, and it typically will go on the right side of your on the side of your screen as we are engaging. But sometimes it does and sometimes it doesn't. Depends on your setup. So if you can get into that chat, that would be great. We can see your interactions and your comments.
get it back so Clayton can
Perfect.
get his going.
Hi, Katie.
Are you guys all seeing that presentation now?
Yes, but we're seeing not in a big screen. Oh, wait. Yes, we are. I'm sorry. Yeah. I'm seeing my screen back behind it, and I'm looking at All right, we ready to go ahead and get started?
Sure.
All right, so Jordan told us all, and I put it in the comments if you all want to see it for anybody that just joined. I think one person just joined. I think that's Katie. Is about the appreciation event. But if you can, show us your face and let's see video. Those of us that are working from home, it's always nice to see people's faces and be able to interact. Also through group chat, I encourage you to interact through group chat as Clayton goes through this presentation. I would like to introduce Clayton. He is one of our recently added board members, and he's been a great addition to the team. A little bit about Clayton. He, in April of 2020, joined Alliant as an employee benefits consultant and opened up an office in Kennewick, and making Alliant the first national benefits brokerage to have a physical location in the Columbia Basin area. Nice job, Clayton. As an advisor for our clients in the Central Washington region, Clayton and his team pride themselves on providing their clients with innovative and creative strategies to help employers achieve their business goals, objectives through their benefit plans, from alternative funding strategies, enhancing company culture, to creating a healthier workplace. We all know good benefits improve our cultures in our workplace. Prior to joining Alliant, Clayton graduated from Washington State University, go Cougs, and started his career as a benefits consultant at Unum Group, an industry-leading financial protection insurance carrier in the employee benefit space. While based out of the Unum's Seattle office, Clayton advised brokers and consultants throughout the Northwest on financial protections and enrollment technology solutions for their clients. Born and raised in Richland, he's probably glad to be back in this area. Clayton is excited to be back in his hometown and helping employers throughout the area create a strategy to combat the cost of healthcare inflation and provide meaningful benefits to employees. So I would like to introduce you to Clayton, who will be talking us about future-proofing our benefits, especially during this time. So I'm looking forward to hearing what you have to say, Clayton. It's all yours.
Perfect. Well, thanks, Renette, and thanks to everybody for letting me be here today. As Renette said, I'm Clayton Simundson from Alliant Employee Benefits, and my goal today is really to just share some ideas and trends that our firm's seen nationally within our client base, from family-owned small businesses to Fortune 500 companies. Hopefully today's conversation will help arm you with information and considerations for you to think on, knowing what the future of the benefits landscape looks like. And before we really dive into it, please feel free to just totally interrupt me, interject. I'd much rather this be a conversation than me talking at everybody for an hour. So don't hesitate to pipe in whenever you see fit. So before we talk about what the future looks like, I think it's important that we really dive into what the benefits or why it's important to look at the future. So stepping back, I'm going to use a weird analogy, but hopefully it gets the point across. I think we're all super spoiled being in the Tri-Cities, right? Because we have the Columbia River and Snake River in our backyard. So I'm going to go on a whim and say that everybody's either tried to wakeboard themselves or has seen somebody do it. So thinking back to when I first started wakeboarding, I remember sitting on the back of the boat, strapping into the board for the first time, and my whole thought being, all I know about the future is that when I scream hit it, the boat's going to pull and we'll see what happens. So I floated off the back of the boat, tension got put in the line, and all I knew about the future was that that power was going to be there. Long story short, every time that I tried to get up on the board, I was holding my current position, the board was facing the opposite way that I wanted it to, and I kept going up and over and then swallowing a bunch of water on the other side. But after a couple of tries, I positioned myself a little bit better in the water, putting a little more weight on my back foot and holding the left side of the board a tad bit higher out of the water so that hopefully it would project me the other way. And that time when I yelled hit it, all of a sudden I popped right out of the water. So the point of this is that the future each time that I yelled hit it was that the boat was going to pull. But the time that I actually did some investigating and made a couple of little moves and tweaks was the time that I actually had my first successful attempt. For most people that have been in the business world for a while, have probably heard the saying, you either change with the times or you get left behind. And if you make changes early, you will end up leading. So what does the speed of change look like? Hopefully I can get this moving. From 1995 to 2015, only 12% of the companies in 1995 that were in the Fortune 500 actually remained there in 2015, which means that only 60 companies actually held their prevalence and dominance, and it's because they innovated throughout those times, while 444 others fell off that list. The next stat about the changing times I thought was really eye-opening. My mom's a 5th grade teacher at Wiley Elementary in Richland, and she came home with a stat from a conference that said that 65% of kids in primary education today will work in jobs that don't exist yet, which I found that really hard to believe until I started thinking like, okay, well, 15 years ago, how many Uber drivers were there, right? I think just knowing as an HR professional that the future, we don't necessarily know what jobs are going to come with the technology advancement, but we have to know that that's out there and can be coming down the pipeline. So I know what we're all thinking now, and that's I'm way too swamped to think about the future. We'll cross that bridge when we get there. I normally like to see how other people do it first and then kind of follow in their footsteps anyway. All of those are super valid excuses. But the only way to better position ourselves for the future is to start investigating what the future holds and thinking about what solutions you can provide in the future for your workforce. So I just encourage you all to really use time as an asset and get creative. And you know that you may not be an early adopter, but I'd encourage you all to be early investigators. And as the great Stephen Wright, comedian, said, I put instant coffee in the microwave oven and almost went back in time. So how do we stay on top, right? And so what most organizations do to stay on top is they're bold, they take risk, and they create culture. So to be bold, you have to be you'll be rewarded for taking chances, but the only way to know what chances to take are by surrounding yourself with partners and colleagues to build your think tank and share ideas. So those people in your think tank can be people in your personal life, they can be people from your workplace. And what I'd really encourage everybody to do is take advantage of the SHRM network here and bounce ideas off of others that are in the same profession as you at different organizations to really start having some of those idea conversations. The second thing is you have to take risk, and let's be honest, no business would ever be successful if they took every single risk known to man. But be willing to take risks where it makes sense and where they're smart, and know that it's okay if your first shot when you get up there doesn't hit the bullseye. All you have to do is step up and hit the board, and with each shot thereafter, walk it in a little bit closer. The most important of these three, though, is to build that culture. So when you build the right culture, not only does it help you build your think tank, help you understand what risk you need to take on, but it also helps your employees buy in, right? Because if I work for a company that's super innovative, I will forgive a mistake that's made along the way because I know my company is trying to set me up to be to make my life as easy as possible in the future. So what we are going to actually talk about today, the 7 ways to future-proof your benefits. We'll talk about employee testing, virtual medicine, health concierge and network management, prescription management, flexible schedules, text coaching, and total workers' compensation. And so some of these, some of it's very short-sighted. Hey, let's talk about COVID. Others is very like, hey, what's just on the horizon as a new Generation Z is entering the workforce? How do we expect that to change things? And then what are some really easy, subtle ways to change our benefits plan, as well as what are some bigger benefits plan ideas that we can take on, but know that they take a longer time to implement. Any questions so far on what we're going to cover today? Nope. So number 1, employee testing. So right now, I think we all have a super heightened sense of importance to this because of COVID. Each and every one here, I'm sure, had conversations with the rest of your HR team and leadership in April about, hey, how do we return to work? When's it safe? How do we go about it in a safe manner? And we also know that each company has a different need for returning to work. Like a food processing company like Lamb Weston can't necessarily bring their work home the same way that a software development company can. So what we found are that a lot of companies are taking a variety of approaches in bringing their employees back to work. Some make them do a symptom checker every day. Others do temperature checks as they walk into the room or into their office. And then others are actually having their employees go be tested, or just a combination of the things above. So for COVID's purposes, if you're going to have a testing protocol, I want to make sure that you all know that it's really important that you have a reporting tool to kind of help you understand where's our issues or hot buttons within our company. For example, if somebody on the second floor tests positive, it's important to know in real time, hey, they tested positive, but how do we go about mitigating the other risks? Do we send everybody on the second floor home? Do we send everybody in the whole building home for cleaning? But having data there and having a resource to really back your decision making is very important. There's a number of ways that employers can provide tests to their employees as well, whether they're at-home tests, on-site tests, or by giving employees access to facilities to have the test done. What I'd recommend everybody kind of think about with your COVID protocols is ask yourself, is there an opportunity to scale this? Can this go to the future flu seasons that we could look at? Is it something that we could get into biometric screenings? And I think for the future of the benefits landscape, the biometric screenings piece is a really popular way to think about, hey, this is something that could make a big impact on our employees from a health perspective. Because as a nation, we're horrible as a country at getting our preventative care done. Only about 42% of the country goes and gets their actual physical every year, which is kind of eye-opening. And only 28% of Americans who are recommended to get their cancer screenings actually do. So if we know that most folks won't actually go and get those done, if we can incent them to go have a biometric screening done, maybe that helps us outline our red flags or provide that employee with red flags to say, hey, something's not right with my internal chemistry. I actually do need to go see a doctor. And that gives a big benefit to you as the company, because you're helping protect your future large health spends, because your employees are actually going and getting their issues resolved early on. So there's a ton of return to work programs out there as well, but I wanted to just highlight a quick one that we created at Alliant called the Strategic Actions for Employers program, otherwise known as SAFE. So we have, you can do a viral testing as well as an antibody testing. It gives a whole platform to see the results as employees get their tests done, and gives them a variety of ways to actually have those tests accomplished, whether it's at home, having testing be done on site at your company location, or having your employees go to a pharmacy. And I think the biggest thing is knowing that we're all going through this for the first time, right? So there's no right or wrong answer when it comes to how to handle your return to the workplace. But what's important is having a plan, and this is a strategy that the epidemiologists on our team put together. This is pretty generic, so they get tailored for each company that joins our program. But a generic way to look at it would be, hey, maybe we'll start by doing daily screening every day, do temperature checking throughout the day, and if somebody answers certain daily screening questions a certain way or has a temperature of X amount, then that leads them to actually go have a COVID test done. If not, they just keep showing up to work every day and having that daily screening and temperature monitoring. The other piece is the ongoing piece. So it's, how do we communicate to our employees? I know that we're all 7 months into this by now, but it's still good to have those reminders of like, hey, what's a safe way to go grocery shopping? Like having those quick facts of things to think about so that your employees are just as safe at home as well as at work when it comes to the coronavirus. The second way to future-proof your benefits is through virtual medicine. So prior to COVID, most people had probably heard about virtual medicine at open enrollments every year being talked about as a cool benefit that's included, but the fact is only less than 10% of employees actually use virtual medicine. But what COVID did is it kind of sped up that process, and with every healthcare facility closing for all non-essential visits in March and April, it actually led a lot of folks to move into that virtual space. For those that haven't used it before, it's pretty easy. It's FaceTiming with a doctor, and it can be for stuff like, hey, I have pink eye, look and see, that's pink eye, write me a script, right? So that's how it's been used in the past, but I think now that more and more people have utilized it, we'll keep seeing that grow. And I actually talked to a vice president over at Kaiser Permanente last week, and they were saying that they expect that to stay above 80% utilization even after COVID, which is pretty incredible because of how often we all actually do go to the doctor, and thinking that we're going to still have that same persistency on the virtual side after the pandemic is over. A best practice to use with virtual medicine, though, is text messaging, because the one headache of the telemedicine side where you call in or FaceTime a doctor is when you call in, it's, hey, I want to speak to a doctor, and they either say he's free or she's free, or they say they'll give you a call back within the next 20 minutes. With a younger workforce entering in and a more technology-based workforce moving in, having a text option is really key to kind of keep your benefits plan holistic and giving avenues for all of your employees. Americans send 5 times the text messages than they do calls today, which is absolutely wild. But what it does is it gives a open line of communication to a doctor, so you can actually just text in, need to speak to a doctor, I have pink eye. They respond, send me a picture, and then whether or not you got tied up in a meeting or couldn't respond when they first got back to you, whenever you get back to it, you can send it just like a text message, so it leaves that open communication there. And what we've seen, 98.6 is who I work with a ton of the different text messaging vendors out there. 98.6 is who Alliant has for our benefits. So as an employee, I've actually used this, and what they've seen is that they have a 7.8 times engagement rate in telemedicine once somebody implements the text function. So it's a really unique way, kind of trend-setting way to get your employees engaged and give them another resource to receive healthcare. The third thing that you can do to future-proof your benefits is create a health concierge program and manage your network. Health concierge, for those that haven't heard of it, is a resource that you can provide to your employees that allows them to call their concierge whenever they have a procedure that needs to be done. So it's one thing I think we all know, if I go to the doctor and they say, hey, you need to go to a specialist for this, I normally take the doctor's referral to whoever they say and hope that they're in network, and I'll double check that. With health concierge, though, you'll actually be able to call this service and say, hey, I need this done. I want you to look at everybody that's in network. And then they actually go through and they have a ranking of who the best is that's within network, as well as the lowest cost provider as well. So you can really go through and make sure that you're going and seeking the best treatment that's out there, and seeing the right provider for you. Insurance companies do claim to as well that they claim that they check their network and have quality assurance, but if we think of it from their lens, they really want to have the widest network possible, because when we evaluate our benefits as organizations every year, if they tell us, hey, we don't have Cadlic in network, we only have Trios, we're going to say, I am going to go to a different insurance provider that has Cadlic in network, right? But this is a good way to help kind of steer employees to get the most affordable coverage that's also the most effective. There's also 3 other ways to manage your network, and I'm sure that anybody that works in benefits has heard of these before: narrowing your network, contracting direct with providers, and reference-based pricing. These are all really good ways to lower your cost, if that's your bottom line, but they all do come with their consequences as well. So I just wanted to let you know about those. So with narrowing your network, it's exactly what it sounds like. Just like the example I gave, it could be something like, hey, we're going to carve Cadlic or Trios out and only leave the other hospital instead of having both here. So it can lead to a lot of disruption to your employees. If they've been going to the same doctor at the same location for a long time, to all of a sudden not have that avenue available to them. Contracting direct with providers, it's something that you really need to be at a large employer to really have a lot of traction with, but that's basically where you go and say, hey, at XYZ company, we want to make a contract with Cadlic where we negotiate even deeper discounts, so that our employees can go there at a more affordable cost. But again, it comes with a lot of legal steps that need to be jumped through and contract preparation. So there's a lot of legwork on that. And then reference-based pricing is probably the hottest topic right now in the industry. So if you're on a self-funded plan, this is when you as an employer make a contract and say, hey, our plan pays this specific procedure at X amount based on the average cost of that procedure in the region. So if your employee goes to Cadlic and has a knee replacement that costs $30,000, but your plan says, hey, we only pay that up to $20,000, you basically put the healthcare provider in a take it or leave it scenario. And with it being relatively new to the insurance landscape, I think we're just now starting to see the first few lawsuits come through from reference-based pricing of healthcare providers actually filing lawsuits against companies because they wouldn't pay the full amount. So just something to really consider as you go through and are talking to folks about potentially going reference-based. Again, though, all 3 of those are super valuable if you're just trying to get to a bottom line number and the most savings possible. But circling back to the health concierge, what we talked to earlier, this is just a little example, and it's really where I see the future of benefits heading, kind of like how the HSA plans were the craze of the past, right? If we look at this example, Ken had his right knee replacement prior to when his company implemented a health concierge service. So he went to Dr. Jones because he was in network. Surgery was a success, but he had a bad billing experience. The company paid $30,000. Ken paid $3,000 out of pocket. But then the following year, the following year, he now has to have his left knee replaced, which I think we can all agree would really suck to be Ken if you had to get 2 knee replacements in back-to-back years. But the following year, he goes in, calls his health concierge, says, hey, I need to have a knee replacement. They get him to Dr. Smith at another facility. And the incentive that his company provided is, hey, if you use health concierge, you only have $100 deductible versus your full $3,000. So you can kind of incent employees to utilize that service. So Ken ends up going to Dr. Smith. Great outcome, great experience. Providers are all paid immediately. The company saved $5,000 on his knee replacement, and Ken saved $2,900 because he only had to pay that $100 deductible instead of the full $3,000. And so it's really about helping steer employees to still get great healthcare services, but also identifying what the right facilities are for you and helping save money in your medical plan. Any questions on health concierge or anything? I'm going to take a quick water break in case anybody wants to unmute. Nothing, because insurance is so fun. Everybody wants to talk about it. A couple of health concierge companies that we do work with are Bind, Asserta Health, and Simple Pay. So with your current brokers, I'd recommend asking about that if this is something that intrigues you, or if you want to, feel free to reach out to me to kind of talk through that health concierge process and how you could really incentivize your employees to utilize it and what the benefits are for your organization. The fourth way to future-proof your benefits is through prescription management. And I'd say as an industry as a whole, we've done a really poor job of training HR professionals and organizations across the country because we've taught you how to buy insurance and made it super transactional rather than teaching you how to manage your healthcare and really do that through seeing your employees' health as an asset. What the insurance industry has done traditionally when it comes to prescription management is said, hey, let's look at different formularies. Maybe we can cut some drugs off of our list to lower our cost and spend. Or that they say, hey, let's look at a different pharmacy benefit manager. But I think if we know that 7% of your participants are making up 72% of all of your costs, and that people with 3 or more chronic conditions are spending 58% of your total cost, and that 20% of your high-risk patients are due to diabetes, the better way to really tackle it versus just changing the formulary is to really start tackling a solution for chronic condition management and prevention. Because if I can manage these conditions, I'm not only creating a healthier workforce and keeping my employees healthy and happy, but I'm also saving a large amount of money and spend and preventing those future large spends by helping my employees get the treatment they need earlier before it becomes a chronic condition. So the 2 ways to really manage chronic conditions is first, you manage the pharmacies and your prescriptions for your employees that already have chronic conditions. And secondly, you really create an engagement platform and strategic communication plan to really help employees understand what's going on. So first, an example of managing pharmacies is one of our partners, Tria Health. They really focus on the pharmacy just as much as you focus on the doctor when you look at your network, right? And they help employees understand what drugs are rated better than others, and also what drugs are just as effective, but maybe more affordable. So they really identify the gaps that sit within your prescription spend. And they're unique because they have a $4 per employee per month cost, but they have a guaranteed return on investment of 1-to-1. So it's really a no loss, a no lose situation for you. And their average ROI is $3.70 to every dollar that you put into the program. So that's one partnership that you can think about making within your self-funded medical plan is really, hey, how are we managing our chronic conditions? And is there a partner out there that can help us identify those gaps? The second piece is from the communications standpoint. You can really target your employees in order to educate them on certain topics, and you can be really deliberate and precise in how you create your campaign and distribute it. I think the one-size-fits-all approach that we've gone with in the past resonates for some employees, but not all. And the way to get the most reach is to really have a tailored strategy to try and make an impact to most of your employees. And if you're on a self-funded medical plan, you already have all of your claims data to make the decisions of who to target as potentially at risk or currently diagnosed with these conditions. At Alliant, we have our own proprietary data analytics platform where we take the raw claims data of your group and really dissect that data to use predictive modeling in order to help develop that communications campaign. And you can target it to just mass awareness on a certain topic. So if, hypertension is the leading claim at your company, you can do an email blast to all employees. And then the employees that are currently taking a prescription for something or are potentially at risk, maybe you do a personalized postcard of the signs of hypertension or things like that. So you can really tailor it down so that you're having the biggest impact on your employee base as possible to keep them healthy. The fifth way to future-proof your benefits is through flexible schedules. So COVID really didn't change the working world. It just sped it up by about 10 years and made it accelerate faster. Going into COVID, about a quarter of Americans were telecommuting at least one day a week. And a recent national SHRM survey showed that 45% of those working remotely now want to continue that in some fashion, whether it's 1 day, 2 days, or 3 days a week moving forward after the pandemic. And some studies are coming out and saying that there are up to 40% of the workforce could be independent contractors by 2025, which I think is a little bizarre and might be too far-fetched. But I think that we all know that the gig economy is growing and that we'll see more 1099 workers entering the workforce and partnering with you at some level down the road. But the reason why I think that the 40% is a little inflated is because of some recent legislation out of California that restricts what employers can do for contract employees. So one of the things that I think about from your shoes is like, hey, as an HR professional, if we're going to have 1099 partnerships, what can we offer those employees? How do we get them ingrained in our culture the same way as our W-2 employees? Is that something where we should be focusing more time on? Do we want to stay on the more traditional path of the W-2, and what's the legal ramifications of each? And technology's changed as a whole, right? And it'll continue to drive change. I think if we look at the industry, at our business 10 years ago versus 15 to 20 years ago, we've seen just how email's totally taken over our lives and now is sitting in our pocket, right? So what's going to happen in the future is something to also think about. And it's really made an impact in industries where we thought were kind of untouchable by technology as well. If you look at, I just went through Lamb Weston's facility, I don't know, a month ago or so, and they have tubes all over their facility in Richland, and there's just potatoes flying around, and you're like, holy cow, I hope that doesn't break and smack me upside the head. But at the same time, it was a really good move on their part to be able to limit the amount of labor that they need to move something from one part of the facility to the next in their fulfillment process. And then we're even seeing it in the hotel industry where those Roomba vacuums and more commercial versions of that are taking over. So you actually don't need as much housekeeping service because they can be more efficient if they go in, turn on a Roomba and do the other housekeeping duties like change the towels while that's vacuuming up the room. So I would just think back of how technology's changed for you over the last 10 years. How's that going to expand in your industry over the next 5 to 10 years? And then what does that do to your workforce? If you can start visualizing like, hey, does that mean that we need to actually bring on more people? Does that cause us to decrease in size? Or do we kind of have to maintain the same, but will that bring in new training challenges since some of the things that our employees do is going to be automated, so they'll have more to take on in their workload. So the keys to success, I'd say, are create engagement and compelling passion. Employees want passion. That's their biggest thing. That's the biggest thing that drives millennials and Generation Z, is they want to feel like they're making a difference in their work, and they want to feel it in the culture of the company. The cultural shift's really already begun there. People are becoming a lot more loyal to their company based off of their team on a horizontal level of the organization part, not necessarily just because of the vision or mission of the C-suite. So that leads to realizing the power of lattice over the ladder, and understanding how your employees are actually buying in and growing their loyalty to your organization. And then the third thing, and this is somewhat bizarre, but reconsider when employees want time off. I read an HR book last spring that said that more young employees would rather work into their late 70s and take a year-long sabbatical every 10 years until they get there, rather than just working and retiring at age 65. Personally, I'm not one of those people, because I think I'd get bored after about 2 weeks, but I think it's a trend that we may see continue to get traction over the next few years, and really thinking about how are we preparing for that. Is that something that could lead, that could be offered at our organization in the future as a benefit, is having sabbatical leaves? What are the impacts of that? How do we train someone to backfill that position for their year-long sabbatical? What would that even look like here? So just things to think about based off of the trends that we're seeing in the industry. And then the last one's more of just a fun stat, I thought, but continuing to leverage technology. I think COVID made everybody have to do that early on. But Zoom prior to COVID had 10 million participants, and now has gone to 300 million in just 9 months. So I think really knowing, like, hey, this is kind of the way of the future. As more folks want to keep working from home even after the pandemic, what are other things that we can bring in from a technology standpoint to really help streamline our business operations and make us as effective as possible in the workplace? The sixth way to enhance or to future-proof your benefits is to enhance your EAP or employee assistance program. COVID made a huge impact on this, right? As traditional medical visits, claims went down in March and April because all those non-essential surgeries and everything got put off and facilities closed. Mental health claims rose at basically the inverse rate that those dropped. So I think knowing that your employees there is more stress in today's world, and that stress has always been there, but there's more of a spotlight put on of that it's okay to go seek help, and offering services to your employees to have access to counseling. In your traditional EAP programs, they'll normally have about 3 face-to-face visits with a counselor per issue per year, and maybe have some telephonic counseling included with it. There's ways to get the amount of visits up to 6 to 8 visits per issue per year. But a more unique way to really enhance your benefit plan is to add text coaching for your employees. And really what it does is it gives a phone app at open enrollment that you could give to all your employees, so that they have access to a library of different self-help items or different counseling things or FAQs about it, as well as gives them the ability to text with a licensed counselor whenever they have an issue that pops up, or even if it's just hey, I'm having a rough day, I've been thinking about this, I'm not sure how this is going to happen. And what it does is, I think traditionally with the EAP program, we saw a real lack of the amount of people that actually used it. There was only about 10% of folks that would use their EAP. And a theory behind why that is because most people don't save the wallet card that's handed to them at open enrollment in their packets. So the only way to access it is to go to HR and say, hey, I want information on our EAP program. And with the generations that are taking over our workforce, 40% of them say that they worry about being judged. And so, not saying that anybody here would ever judge somebody for coming to them asking for that, but knowing that that's something that's in their mind going into it. If you had an app that you could just share how to access it via email and a company-wide email, I think we'd see a lot more interaction in helping our employees go and get the counseling and treatment that they need from a mental health standpoint. And the final way to future-proof your benefits is to treat workers' compensation as a benefit. I guess a question, and you guys can fill it out in the chat. We'll make this interactive now. Would be, how many of you do get involved in any workers' comp claims at your current organization, or does that fall under a different department than HR? Anybody? All good. If somebody hit it in the chat, I don't know, because it's not popping up on my screen. But most times it's coming from the occupational safety and health team or quality assurance team that's doing those workers' compensation claims. So one of the ways to really think toward the future is, how do we prevent one of the leading injuries for workers' comps claims, which is musculoskeletal disease, which also has a big impact on your medical plan. So if we can manage those claims proactively through avoidance and proper diagnosis, I think you'd see not only huge savings, but you'd also see the culture grow. So a program that we built at Alliant is called Total Workers Compensation. What it is it's basically, you could have an on-site physician or an on-site PT physical therapist at your location with kind of a small sports medicine room or a sports medicine trailer. So whether it's after the weekend and somebody comes back from four-wheeling up in the Blues Mountains, right, and is like, hey, I tweaked my back, they can go get work done prior to going into work. Especially this is for those more blue-collar jobs or the labor industries, so that you're really taking care of those musculoskeletal issues before they become a bigger issue and lead to a workers' comp claim or lead to a medical claim for you. And there's also some wearable technology in there, so it becomes a training standpoint of, hey, if I were to put this technology on one of my employees and just tracked how they moved throughout the day and saw that, hey, maybe we're not picking up, this piece of lumber right, we need to actually be bending our knees versus lowering our back before we pick it up. So really utilizing it to help educate employees, so that we avoid those future spends on the medical plan in the future. So we're going to get out a little early today unless people have questions, but the last note is to really look at where you are today, but see the future. Even if you aren't moving yet, be ready. Like I said, you don't have to be the first adopter, but investigate early so that you kind of know what's coming and have it thought through before the day comes that you need to cross that bridge. Any questions? That's all I got. Thanks, Nevada. Appreciate it.
All right, so any questions for Clayton? That was great information. It was a great timing. Some statistics were very interesting as well. I was surprised to see how many people don't do their well checkups. That was shocking to me.
No, crazy.
And also the FSA thing too, I've never understood why people don't utilize that more. I just think it's such a great benefit to have. So some great stuff. Anybody have any, the EAP text coaching is something to think about. Yes, that's a great idea. Anybody else have any comments or questions for Clayton? It's your opportunity to ask any questions that you might have about benefits, especially right now with everything going on. So, all right. Well, with that, we're going to get done early. You guys got an extra 15 minutes on your lunch hour. So thank you so much, Clayton, for being here today. And thank you to our members that are here today and engaging. And we will have something out soon about any webinars that we're going to have in November as well. So everybody have a great day, great weekend. And we will, thanks for participating. Some of you I see have been here all week for all 3 sessions. So thanks for being a part of that with us. All right.
Welcome.
See everybody
Thanks, everybody.
soon. Bye-bye.
Bye-bye. Thank you. Thanks, Jordan.